I am currently on board the MV Hondius, and what's happening right now is very real for all of us here.
We do believe that there may be some human-to-human transmission that's happening among the really close contacts, the husband and wife, people who've shared cabins, etc. So again, our assumption is that has happened. Hantaviruses don't typically transmit that way.
3 people have died in an outbreak of a rat-borne disease on a luxury ship. So what exactly is hantavirus, and should you be worried about it spreading?
New details on the deaths of Oscar-winning actor Gene Hackman and his wife.
An autopsy found Hackman died of heart disease and Alzheimer's. Hackman's wife, Betsy Arakawa, died a week before Hackman of hantavirus, a rare respiratory illness spread by rodents.
They're relatively rare infections.
Daniel Bausch is a specialist in tropical diseases at the Geneva Graduate Institute in Switzerland. He said the virus is only rarely passed between humans and is most commonly spread when people have contact with rodent droppings, urine, or saliva. But a cruise ship might create the conditions for person-to-person infection.
We know that cruise ships and other events where we pack a lot of people into small places, that they always have the risk of human-to-human transmission of different pathogens.
Hantavirus usually begins with flu-like symptoms such as fatigue and fever. 4 to 10 days later, coughing, shortness of breath, and fluid in the lungs appear.
And so we can see in hantaviruses that people develop essentially a pneumonia or a consolidation of fluid filling up in their lungs, and that can happen very rapidly.
Bausch says there's no specific antiviral drug for hantaviruses. Treatment, he says, often requires hospitalization in an intensive care unit.
It's not the sort of treatment that is generally available on a cruise ship.
The World Health Organization said it's been told there were no rats aboard the ship. Its working assumption is that the cases originated in a Dutch couple who joined the ship in Argentina. That couple may have been infected before joining the cruise.
Hantaviruses have or can have at least a relatively long incubation period. Incubation period is the time from when you get exposed to something to when you fall sick. And so in hantaviruses, that can be, in extreme cases, up to 6 weeks.
The World Health Organization assesses the overall public risk from this current outbreak to be low.
This is not the next COVID-19. This is not going to be a big outbreak. This is not a reason for your average person in the world to panic at all. If you had tickets for a cruise, I don't think you need to cancel it. And now that you know that it's possible, because it's pretty rare.
There's a lot of uncertainty, and that's the hardest part. All we want right now is to feel safe, to have clarity, and to get home